I call the member for Ballina.
Thank you, Madam Speaker, and I rise to contribute on behalf of the Greens on this public interest debate and recognising the efforts of frontline health workers. And we also join and thank the member for Wakehurst and the Minister for Health and Medical Research for bringing this important notice for public debate. And we also all, as a party room, recognise his incredible work over the last 9 months. And I haven't heard anyone in here or anywhere else that has had anything other than gratitude for his dedication and his entire department. And also, in particular, just to note, the Chief Medical Officer, Dr. Kerry Chant. I know our health spokes, Kate Fairman, has just said that what she has seen, and certainly my experience, the generosity, even can only imagine the work that she's done and continues to do, but also taking the time to brief members of Parliament on a very regular basis, and also the Deputy Chief Medical Officer, Dr. Nick Coatsworth. And I think what we've all been so grateful for is that the Premier has not been guided by politicians or indeed her own head, that she has been guided by health, the absolute best of the best in terms of epidemiologists and medical professionals. And I think that is why New South Wales, and obviously it's not, that is not an original thought, but we all can see that the reason that our everything from contact tracing to the COVID plans that businesses right across New South Wales have implemented is all because of that science and that incredible work. And at the moment, and what we saw was a global recognition and a global awe for our health workers. And remember those scenes, these incredible scenes in Italy and other European countries of daily people just standing out on their balconies and congratulating their frontline workers. Because of course, everyone from our nurses, our doctors, our GPs, our allied health workers, our paramedics, our cleaners, administration staff, none of those people have been able to say, you know what, I don't feel safe at work. They have shown up, they have had to put their own health at risk, they've had to put their family's health at risk, and we know that so many have actually stayed away from their families for prolonged periods. And we recognise and celebrate all of their efforts. And some of the high risk, like anaesthetists, it is such a high risk when they are intubating someone. They've put themselves over and over at risk. The porters, who are very poorly paid and barely noticed, entering rooms on a daily basis. And of course the cleaners, who are the first to go in infected rooms, they are the first to go in. And we know, and we welcome any opportunity to lift their pay post COVID-19. The contact tracers and the epidemiologists who supported our frontline workers, without their expertise, without their science, that puts our frontline workers at risk. The lab staff and the testing pathologists who've worked incredibly long hours. And also, of course, the psychologists and counsellors and mental health workers who have picked up the slack. They've had no choice, they've shown up, they've sacrificed, and we are all incredibly grateful. I'd also like to mention the Health Services Union and their advocacy, the New South Wales Nurses and Midwives Association, the Australian Salaried Medical Officers Federation of New South Wales, and the Ambulance Division of the Health Services Union. Our AMBOs, so often, are doing double shifts just to make sure that no one in the community misses out. And also just want to mention some of the groups in both the seat of Ballina, Newtown and Balmain, Glebe Youth Service, Rozelle Neighbourhood Centre, St Vincent de Paul Rozelle, Chin Chin and Butter in Surrey Hills, Addison Road Community Centre, in my own electorate, Hong's Kitchen of Ballina, that hand-delivered fresh cooked meals to nurses and GPs at the Ballina District Hospital, and the Cherry Street Bolo, free meals, and Lisa Marie of Table Grace. And of course, Wayne Jones, the CEO of my area health district, has been extraordinary, and I know that the member for Lismore shares that view that I have. Everyone across the state have shown themselves, every frontline health worker, that they are the real heroes in this story.
I thank the member for Ballina. The question